Good afternoon, friends. Today we don't need to take much time. It's short briefing only. Yesterday night also, 17 samples got tested positive. And then today another 9 got tested positive. So total it is 26. The total number of positive cases in the state now stands at 156. Out of these, the total active cases are 126. All the positive persons are receiving medical care at a designated COVID-19 hospitals. With a view to further strengthen the manpower of the Health and Family Welfare Department, the Cabinet in its meeting held yesterday, that is 11 June 2020, has approved creation of 53 posts of special doctors for 11 district hospitals, creation of 1 post of Director of Medical Education and Radiation Safety, Medical Education and Radiation Safety, Director, Medical Education and Radiation Safety. At the level of special selection grade pay. Then creation of 5 posts of zonal leprosy officer for Longland, Kipiri, Perian, Pek, and Zonabuto. At the level of senior grade pay, encadrement of 2 posts of district vector-borne officer for Tuinsan and Zonabuto in the cadre of Nagaland Health Services. As and when the present incumbent vacates the same to be made by medical doctors, creation of 143 posts of staff nurses to be deployed in all the districts, 143 nurses. But if you want a copy, we can give you. Yeah. The Cabinet also approved age condonation of 28 staff nurses under Health and Family Welfare Department, and fresh appointment be made against the sanctioned posts. Regularization of 19 serving contract medical officers under the Health and Family Welfare Department, and regularization of 27 existing medical officers who have been engaged by the department for a period of 1 year. The Cabinet further directed that this approval is one-time relaxation of laid-down rules and procedures for recruitment, regularization, and condonation of age. Further, this one-time measure in view of prevailing situation in the backdrop of COVID-19 pandemic shall not be treated as a precedent. A special train from Thiruvananthapuram, Kerala, which departed with 966 persons on the 9th of June 2020, is reaching Dimapur tomorrow at 5:30 a.m. This train has been taken from the stranded people of Nagaland from the state of Kerala, Tamil Nadu, Telangana, and Andhra Pradesh. Another special train from Delhi with about 1,000 persons, will be leaving Delhi on the 14th of June 2020 at 6 p.m. and will reach Dimapur on the 16th of June 2020. Apart from this update, I want our spokesperson, Mmhonlumo, also to say something about the prevailing situation.
So once again, good evening to all of you. I'd just like to supplement our Honorable Minister with a few information. Today, the high-powered committee led by our Honorable Chief Minister had a video conference with the DCs, CMOs and SPs of all the districts, and this is how we've been regularly keeping in touch with work on the ground. And the Chief Minister took ground report from all of them to assist the high power committee in understanding some of the issues that our administration, the police and also the medical department faces on the ground. Further, in the afternoon again, the Chief Minister had a webinar with Dr. Jitendra Singh, who is also the Minister for Donor, and DAR, PT, Government of India in the PMO. So the gist of the discussion, he asked me to inform you. Number one, the proposal by the Government of Nagaland for initiating an e-office so that all file tracking management and all that will be done electronically has reached the donor ministry, and the minister himself has acknowledged and that that is the priority of the Prime Minister's program. Secondly, he also reminded the donor minister that the submissions already made for the airport in the capital be reminded for renewal. And during this pandemic, to ensure that our economic policy for the unemployed youth will be facilitated and supported if one of the major projects which we have already placed before the Government of India, which is the Trans-Nagaland Highway, or popularly known as the Foothill Road, be taken up on priority. So these are the two issues besides the e-office, which was discussed by the Chief Minister. He has asked me to inform you. The other information I would like to give you is that there has been lots of queries on the expenditure by the state. If you recall, we have already given you the amount spent by the Government of Nagaland for stranded citizens of Nagaland who are not returning to the state. The amount has been placed before you. It's also available on the website, as I already mentioned. Today, we would like to highlight the expenditure incurred by the Government of Nagaland in the preparation and the management of quarantine centers as on 12 June 2020. I would also, before quoting the numbers or the amount, like to cite that the Government of Nagaland, through its district task force, hires caterers for all the mess service, food service in the quarantine centers. So it is not, it is handled by the caterers who are hired by the district task force. We pay them money, and the amount that we have incurred till date is 8 crores 68 lakhs 63,146 rupees. This is for all the districts in Nagaland. I will repeat, 8 crores 68 lakhs 63,146 rupees. This is for all the districts in quarantine centers. So you would see that the government has been incurring these expenses so far for managing the quarantine centers and feeding our beloved returnees in Nagaland, in the quarantine centers. So any quality of food and all that issues is taken up by the caterer, and if there is any complaint, the district task force is tasked to ensure that the caterers do their duty for the money that we have paid them. Let me complete, then we can come back to the question hour. As on 12 June 2020.
No, sir. From when managing of the quarantine center, from which date?
So from the beginning, it's on the website. The other expenditure which the government of Nagaland has incurred, and we would like to inform you, is there are two types of mode of traveling. One is the special buses to bring our stranded citizens, both students and working professionals, to Nagaland. So the government of Nagaland has hired 32 buses to transport our citizens from 13 different states to Nagaland. The amount incurred till date for the buses and also for the 9 special trains which we have hired is approximately 1.65 crores, which is 1 crore 65 lakhs. So this is for both the buses and the trains. So the government of Nagaland has spent this much to bring our beloved citizens to Nagaland. And also, while they are in quarantine, to ensure that we pay for their food and lodging. This amount has been spent. The other details, I think our Minister will open for discussion.
Yeah, we have actually good news if we are to talk about this recovery. Out of this cumulative 156, total recovery as of now is 41. It is going on very fast. We thank all the frontline workers, and total active is 115. But apart from that, if you want to know from our medical department,
Floor is open.
yeah.
So how about the expenditure for the buses returning to different districts from here to districts going on in Mmhonlumo?
Sorry?
The expenditure.
Different districts. So this is borne by the district task force. So we will be giving you the details of the inside Nagaland next press conference. Today,
And
yeah.
in this connection, almost all the buses are LST buses.
Yeah.
All right, so later on, you would be getting.
We'll give you the details because this is not the end of the transportation. No?
But of course, some districts are also hiring private buses also.
So does this include people from staying here, going out to other states as well? Or?
No, this is only for bringing stranded citizens of Nagaland.
So I wanted to know how much amount you are likely to spend for a returnees, the total amount, and the total returnees. Would it be over 10,000?
Sorry?
The amount that you are going to incur on this?
You're asking two questions. One is the number of people who are coming. Is we still have, as our minister has mentioned, one more bus coming tomorrow, then another bus coming from another train coming from Delhi. So for that, you see, there are people who register and who deregister. Once we get the final number who board the bus, we will be able to make an assessment. And in the next press conference, when that time they would have arrived, we would give you that detail. This is the detail of how many have arrived and how many expenditure we have incurred.
So I wanted to know the total amount that you are likely to incur on this returnees.
We have not calculated that one.
Would it go to 200 crore or 150 crore?
For the returnees?
Yeah.
No.
Not in the quarantine center, all,
Overall
yeah,
expenditure.
overall.
See, for preparation, management and maintenance, I don't think it will reach 200 crores. But we will be able to give you a report in a few days' time. this calculation will be made, no? Because right now, the state and its entire machinery is busy looking after the daily, affairs of the quarantine centers and also the positive and negative cases. So, yeah.
Sir, so from which date the return started returning, and then how many have returned so far?
Yeah,
We have a,
like government arrange trains and buses. If you include the two trains also, one coming tomorrow and another one which is expected on 16th from Delhi, this will be about 7,700. And so this is what, I mean, the number is for those people who have come by special trains and buses. Then people coming by these trains, the regular trains, Rajdhani, Brahmaputra Mail, that is right now more than 3,700. 3,700 people who have come on their own.
Abhishek, it's available on the website as well, no? We will put it up on the website.
I want to ask, Director Legal, some people are demanding that their test results should be shown to them, whether it's negative or positive, or a lot of people are saying that why the results are being hidden, why the results are not being shown to them.
Actually, when we do the testing, we don't have that type of format like you do for blood testings or for other investigations. But it all comes with coded numbers. So from that, we tell them that the hospital or whichever quarantine center that this fellow and that fellow has become positive, or these ones are negative.
So is there any protocol that the status of the test should not be shown to the
There's none as such, that you should not be shown to them. No? But the thing is, we're doing in such a huge number now that we're not able to print out separately for any individuals.
Sir, also even in the last briefing, we had asked for the number of people who have tested asymptomatic or symptomatic during the arrival,
Okay.
as, when their screening was done
Yeah.
at the entry point.
Yes.
So can we have those numbers, sir? After the revised SOP was issued.
So far, most of the cases are showing asymptomatic only.
If we can have the numbers.
Yes.
During the screening, how many we detected?
During
So as of today,
You came half an hour late. Yes. This morning,
we'll give you the figures.
Morning.
Yes.
this morning issue in Terry Farm, where one Manipur truck driver
Yeah.
collapsed, and that issue, because so many rumors are going viral.
Yes. Regarding that issue, this was a Imphal Manipur-bound truck. So it got, broke down on the way. And so while the driver was doing that, I think he collapsed. So now, getting the records from our hospital doctors, they have said that it is something like a stroke. And then he was showing signs of internal bleedings, means intracranial bleeding. So he's still unconscious and admitted.
Yeah, sir, and there
He is not positive.
He's not positive. His sample has been collected.
Amy said,
Yes.
is a rumor.
Yeah, that's a rumor. But getting to her question, there was a delay for over 5 years for the ambulance to arrive for the patient, Like, it was reported around 7 in the morning, but the ambulance came around 11. First
Okay.
ambulance came around 11:15,
Yeah.
but two persons came. One, both of them were wearing just raincoats only.
Okay.
Why is that? Why is that so in this situation?
I don't know, but probably these days people are so, think even our health workers are, unless they're with proper PPE and all, they're not, they're hesitant to handle anybody. So probably because of that, the delay happened.
But this is no such a serious issue, no? Sir,
Yes.
the high-powered committee has decided to relax on the opening of the churches.
Yes.
So when can we expect the other relaxations?
Sir, in addition to that, in that relaxation order for the magistrate clause C, it's written only asymptomatic
Yes,
person
yes,
will be allowed
yeah.
to enter the church.
So that basically means that people who are having some fever or any other, say, symptoms, not necessarily COVID, matlab is that you should be fully healthy and not showing any type of symptoms. So they only should be going. On this, Dr. Nyan can also just mention about this and has come up. Dr. Nyan will also.
Yeah, of home affairs. So since we are in COVID times, we tend to refer each and everything as asymptomatic and symptomatic. So basically what we can infer from the order is that those people who are sick, and as all the previous advisories which has come out earlier, where it is mentioned that if you are sick, you stay at home and not to venture. So I guess, not I guess, but this is for those people who are sick, not to come to public places.
In one thing we decided, and we are also seeking the opinion views of the district task forces and other stakeholders also before decisions for other type of relaxations will be taken. But
Today we have taken the opinion of all the deputy commissioners, CMO, SP and others. So after that, now we